Back now to this EpiPen story. As the fallout continues, there's one analyst who's predicted the FDA will rush a generic brand to the market. Former FDA official Peter Pitts is here. And this outrage, Peter, thank you, number one, for joining us.
Sure.
We were talking about it earlier, and what can you add? And for people who weren't here, the basic discussion was that, Mylan does not have competition, right? And they keep raising the prices. This one was a drastic raise, and people are very angry about it. But if there was competition, if somebody else was in the market, you wouldn't be able to do this. Competition would keep the prices lower. What's keeping that from being the case?
Well, the EpiPen is hard to make.
It is?
The concept behind Hatch-Waxman, which is the legislation that allows the FDA to approve generic drugs, means safe and effective and quick. No human trials.
Now, I know nothing about it. Obviously, I know a number of friends who have children who have to use it, and it is something, life and death serious. We know that. Why is it hard to make?
Well, the drug epinephrine is not necessarily that complicated, but it's the device, the actual pen, that requires manufacturing sophistication. From what I gather, the Teva product, the generic that they want to bring to market, has had some issues in that. Now, the FDA can kind of claim victory here. They can be the hero by putting senior resources working with Teva to help them get their product approved and bring competition into the market, which brings access and quality and safety.
Because the criticism of the agency has been that they're not doing enough, and especially, I should put it, they're not doing it quickly enough. So isn't that fair to some extent, that maybe they're not as focused on this as they should be, and now with public attention on it, they will? Or?
Well, back in the Martin Ciccarelli days, during Turing-Freud time, the FDA said they were going to start to prioritize generic applications for first-to-market generics.
Right.
Like, for example, the EpiPen type of situation, and reduce the approval time, or rather the review time, from 2 to 3 years to 6 months. So that was in March. They're trying to get there. They've gotten legislation to give them more bodies to get it done. Hopefully it'll happen. They really can be the hero here to bring these products to market quickly, safely, and effectively.
Right, because there are, so people understand, there are companies, Teva, you mentioned Teva, there are companies that are making a generic version. It's just not at the point where it's approved. What holds something like that up?
Lots of things.
Okay.
I mean, it can be a problem in the manufacturing. It can be a problem in the where they're getting the drug from, how they're mixing it together. There are a million pieces that come together.
It could be bureaucracy too, to some degree, right? Red tape, things like that. Or?
Probably not. I mean, I think the FDA recognizes the importance of this product. They're not going to hold it up, because the other piece here is they don't want drug shortages to come into play. When you've got one manufacturer, not only does the price stay high, but you have the issue, if there's a manufacturing problem, that there could be shortages. And this is a life or death product. The FDA I think the agency's on top of it, but they've got to do even more to make sure it happens quicker.
Peter, thank you. Thank you for coming in, number one, and for explaining your side of this and your expertise, adding that to it. We appreciate it. Peter Pitts, who used to be at the FDA.